So D2C and e-commerce opportunities for global and local medtech companies. What is your personal experience? What's your vision? How has the last 1.5 year modulated your vision and your future thinking, Vivek?
And certain experiences what we had as a digital platform from the beginning of pandemic. I think it will be very exciting and certain facts to hear, and it will really throw the light on how we saw the change, what essentially changed in the industry, and how we saw the advent of digital coming at the forefront, not just from a B2B medical supply side, but I will also throw some context and some data perspective to look at how overall behavior was. There was a change in the behavioral pattern, and what it was leading to, what kind of revenue numbers it was leading to, what kind of user base it was leading to. So way back in 2020 January, I saw a lot of traffic coming suddenly from China. And since we are a digital company, we do a lot of traffic tracking where from it is coming. You won't believe, every day on the platform, I could see at least thousands of Chinese customers coming on Medica Bazaar and trying to search for few basic things like masks, sanitizers, PPE kits, and we could track it, right? We were not selling mask and sanitizer because these were not category to be sold, and these were essentially categories which were very which were there in hospitals, but nobody would care that you are wearing a N95 mask, or you are. It is only required in a quarantine situation, or in situation where you have, say, HIV patient or something, where, or hepatitis patient where you had to take care of yourself. So we saw a lot of traffic coming in. We saw a lot of requirement coming in, and it was a true sense in itself that there was something grossly wrong in China. And I was telling you about first or second week of January, and then third week of January, we saw suddenly a lot of companies here who are representing some form of Chinese entities like Fosun Pharma, or there were some more companies suddenly coming up to us and telling us we need so many masks, we need masks running into 500,000 pieces, 1 million pieces, and then we could sense there was seriously something wrong in China, and that was all out in media. But China being a very media shy country, and they never want to portray a lot of its problem to media. Whatever we were hearing, we were just trying to. It was just cut to 1/10 of the problems which were really available. So I can tell you, from the time we were just trying to see, and suddenly first week a lot of clampdown started happening. FDA regulations came in place. There were a lot of FDA officials sitting at our offices, telling us, and there was a call directly from DCGI office to me telling that please don't sell any mask, just hold on mask or PPE kits. Whatever quantity you have to do a daily log sheet reporting to FDA offices and all that. So I can tell you and we were completely lost. Why is it happening? Why in a country like India, we are not even prepared to, say, produce a 3-ply mask? What is this greatness about producing a 3-ply mask?
Absolutely.
What is there, which we can't do as producing a PPE kit, which is nothing, which just, what we essentially think about a patient gown, or maybe a doctor's, disposable gown being produced like a PPE kit. That's essentially what we had to do. But there's such amount of, I would say, volatility which was suddenly going on. And when the cases started rising up, we suddenly saw a surge in traffic. It was unbelievable. It was running to kind of, if we had, say, 20,000-30,000 users a day, we could see the traffic coming to 300,000, 400,000 users a day. It was 10 to 15 times jump in traffic. And it was sometime, website had, and we were, being a B2B platform, we were never prepared for that kind of even back-end infrastructure also. We never thought that Medica Bazaar platform will have 500,000 traffic a day. And it was because we were preparing ourselves to be more a B2B company and not a B2C company. By nature, design, and an entire modeling of our business has been primarily to serve medical establishment, doctors and professionals. We were never there in the consumer space at all. And we didn't want to be, because of maybe, whatever we were trying to do was only meant to help all the healthcare institutions. And that was the time when we could really feel that there's something grossly wrong. There's something, we know people are really scared. People have, the cases were nothing, you just compare the number of cases in April, May, June, July, there was hardly any cases. The cases actually came in India from the month of July or August, right? From after the time we had certain, outbound, certain activities around, and then we saw the cases actually jumping to to maybe about a lakh a day or less than a lakh a day. That was the maximum which happened in the first wave. But first few months was just a scare which happened, right?
Sure.
And in that scare, people had no other option. Sitting at home, they had to only look at digital option, right? There was no physical meeting. There was nothing going on physically. This was just the digital option. People were there sitting at home.
Sure.
And that's where I think, from our perspective, we were trying to do our best. There were enough challenges which we were facing in the market in terms of supply chain. It was very difficult moving around a vehicle, I can tell you. There was frantic calls coming in from leading medical institutions about supply of masks, whether it is from South India, from North India, for the different places. We run our own kind of logistics operation in the name of MBGO, but that was not prepared to take this kind of a load. And then it was becoming even more difficult to meet up expectation. And customers, if you don't supply them on time, they become aggravated, they become unhappy. You have to deal with it because they're also facing the similar situation with their patients and all of that. So all of this thing was complete nightmare for us that first few months in the COVID. And then when we started gradually settling down, when things were improving, we were obviously, able to see a lot of respite, a lot of change happening. But the good part is that if we were kind of moving here in terms of maybe 10x jump in terms of seeing the traffic and all, we haven't completely come back to the normal. We are somewhere still at a place which is like 2 to 3x, 4x. That means there is a great amount of digital penetration which has happened, especially from a customer mindset perspective.
Sure.
We still see the traffic has really jumped to at least 3 to 4x times. We know that it can't be just at the 10x because that was more of a scare, that was more of push which was happening. But we have seen that kind of a jump happening, especially coming from a legacy and orthodox kind of digital, orthodox industry like medical care, where everything is more on pen and paper, and people just don't want to get into a complete digital way of doing things. But we could see that change happening, 4 to 5 times kind of a change happening.
So Vivek, a quick question, and we can do it now or after going through a few other points. Because that's where your interest also lies. I know, the innovative new product launches that we talk about, driven by artificial intelligence, machine learning, Internet of Medical Things, virtual reality and augmented reality. So, just a quick question. Your success story in Medica Bazaar, how much of it is driven by your team's ability to, if I may say, embrace technology for future?
So by nature and by our business model, operating business model,
sure,
we are a tech-driven organization. Sure. So anything we want to do has to be front-ended by a technology. That is what we have been trying to achieve in the industry today. Yeah. Say, for example, we created the first interactive marketplace kind of a model between buyers and sellers through a digital platform, because that was what we thought that would bring the change through technology. Sure. When we thought that this was not enough, we learned from the data. When everybody talks about data, Anjanta, data is fuel. Very nice. That's a great statement to have.
Yes.
But what kind of fuel? Will it become a fuel which will drive growth, or it will just be a fuel which will be waste, which will not be used for for any kind of growth driver what we are perceiving to be. So reading out from the data, we had thousands of transactions happening over last few years. The great part about Medica Bazaar as an entity is that we learned from the data. We curated that data through various geographical simulation, seasonal simulation, different kind of disease burden simulation, and brought out something which is in the form of AI ML, and it's patented now, which is a tool called Vizi. Vizi, we got Indian patent and we are yet to receive a US patent, but hopefully in about 60 days we will get it, because that simulation in itself was a great example for us to bring something which would help institutions get into the right frame of data of inventory management. And believe me, it is saving a lot of cost for them.
Wonderful.
Something what Vizi has done.
Sure.
Similarly, we are coming up with another product shortly, which will be again learning from a lot of data intervention, especially on the entire equipment lifecycle management piece.
Right.
And this will just not be for the larger equipment. This could even be with a very small pulse oximeter to a very large MRI, PET, CT and all. And that data intervention will build a complete equipment lifecycle management piece together. Excellent. So this is where we are working on that innovation now. So I think we are using AI, ML, all of these technologies in driving our business growth. Sure. And that's the nature and the kind of model we work with.